Hi, my name is Dermot Flynn and I'm a GP based in London, and I work in the private sector and in the NHS. Today I'm going to give you a little talk on my approach to fasting and the FMD, and I call this talk "To Fast or Not to Fast." Here we have a little Shakespeare holding coconut water in his hand. And that's one of the things I like to use on my particular fast. So in this talk, I'll take you through the emerging science around the benefits of fasting and try and give you an idea of how you might safely do it yourself, and actually try and stimulate you to actually take more responsibility for your own health going forwards. So this talk is based on my personal experience with a program I call the Kumru Cleanse, and that's a 6-monthly fast which I've been doing now for the last 8 years. I'm fortunate enough to be able to do this in Brazil, Bahia, Kumru. And the Kumru Cleanse basically is a program that takes 7 days. We have an average of 800 calories a day, and we use a mixture of coconut water, soup, herbal teas and local fruits. We're quite active in the day, lots of exercise, and involves walking, etc., etc. We use Pilates, Watsu, yoga, and keep ourselves quite busy. Distraction is always the name of the game when you're trying to do a fast, and the more you're distracted, and I think in the warmer climate you can do it in, the better. So this is what we do on the Kumru Cleanse. We have a mixture of coconut water, nice fresh organic coconut water, and normally we have one a day. Then we have a lot of herbal tea. We use a local tea, a lemongrass tea, which is a lovely flavor, and it's a diuretic. We have some local fruits as well during the day, mixtures of, be it papaya, mango, pineapple, etc. In the evening we have a nice vegetable soup made up of different vegetables, and of course we keep going with about 2 liters of water a day, and sometimes we add in some salt, and this is what I call the Kumru Cleanse. Kumru is the name of our village in Brazil, which I've had the luck and fortune to be associated with this lovely location for the last 35 years. So fasting has been around longer than you or me for sure. It's got religious connotations, cultural evolution, etc. And of course currently it's been trending for the last 10 or 15 years. And today I again want to bring you on to the idea of intermittent fasting, but specifically the area of fasting I work on is what's called FMD, which means fasting mimicking diets. There's also the ketogenic diet, and there are many other kind of diets that are out there these days, be called the paleo diet, or fast right for your, or diet right for your blood group, etc. So there are many different types of systems out there, but today I'm going to concentrate on the FMD, which is, as I said, the fasting mimicking diet, and take you through what can happen when you go on such a diet. So the fasting mimicking diet, the FMD, 800 calories a day for 7 days, and normally at least 4 hours of activity just to help you burn up the calories and increase your calorie burning. This type of diet over 7 days causes a positive stress, a positive metabolic stress on your body, and this results in a number of different things that happen for the improved glucose regulation, and the maintenance and your repair systems in your body get activated and upregulated. Stress resistance increases. There's a lot of recycling of damaged molecules and actually damaged cells. So cells get recycled and reused. The parts get reused within your body. It also stimulates mitochondrial biogenesis. The mitochondria are the powerhouses of your cells, so it sort of pushes them up and cleans them up as such. There's an increase of a thing called autophagy, and more about that later. There's a promotion of cell survival. It suppresses inflammation, which I like to call deflammation, so it brings the level of inflammation in your body down. increases stem cell activity. We know that from our own personal research on this matter. And it alters the microbiome. So you do a 7-day fast like this and your microbiome will change. It's hard really to quantify and calculate what that change exactly does, but there's a lot of research going on in that area currently, and the microbiome has become a very interesting place in medical research again in the last 10-15 years. So these are some of the processes that we're going to talk about today: ketosis, senolysis, deflammation, and stem cell activation and autophagy. And these are processes that happen throughout this fasting intervention, and some of them last for weeks and months after your intervention. I'll explain more about that later. On to ketosis. So here we are burning up 800 calories a day on the first day of our FMD, our fasting mimicking diet, and we can see that the glucose on the first day, you're using up your glucose that's still stored in your body as glycogen in the liver and other parts in the muscles, etc. So that's the normal mixture: glucose, fat, and protein. And then within 24-48 hours, we activate the GK switch and you move into burning fats rather than sugars. So that changes down. So you can see the fat proportion is much higher. That's giving energy to the cell as distinct to glucose and protein. So from day 1 to day 2, 3, you move into what we call ketosis, burning fats. So ketosis is a inbuilt metabolic adaptive system, as we call it, the GK switch, and as glucose drops, the ketone bodies get produced as part of the energy production within the cell that happens in the mitochondria. Ketone bodies are produced from the breakdown of fat, and they flow throughout the bloodstream and can drip into the urine and are easily measured with a dipstick. So you can easily know when you are in ketosis. Ketosis can actually happen in some people transiently from an overnight fast. Ketones reduce the appetite and help maintain effective fasting. And ketone bodies regulate the expression activity of many proteins and molecules that are known to influence health and aging. Ketogenic diets, which is all about high fat with protein and low carb, and this also can put you into a state of ketosis. It's a current trending weight loss strategy. Atkins, paleo are examples of same. So ketones are a cleaner source of energy than glucose, proteins, or carbs, and they produce fewer molecules that can harm cells, so fewer reactive molecules. One interesting thing about being ketotic and ketogenic diets is that they've been around for over 90 years in the medical world. Not many know about it, but the pediatric neurologists know all about it because it can be a very effective strategy in intractable epilepsy of childhood, of children. And there's a very good online resource on this called the Charlie Foundation, which is worth checking out. Ketosis seems to enhance the ability of mitochondria to deliver our body's energy needs in a manner that reduces inflammation and oxidative stress. As I said earlier, it's just a cleaner form of energy. Why does ketosis have such wide-ranging effects, positive effects? We really don't fully understand how it works, but for sure it looks like it has an effect on our mitochondrial function, which then has a knock-on effect on other issues around the body. And now, deflammation. So the easy peasy way to deflame your small intestine would of course be just whip out your small intestine and run it through with a jug of water. But of course that's not possible. This is one of my favorite slides because it was my son actually drew this picture for me, and I think he gave an impression of his dad, but I like this slide for that very reason. But easy peasy isn't possible, so we've got to do it the hard way. So location, location, location. Let's get down to where the action happens, and really it's more about, here we can see in this slide, we've got the colon, we've got the small intestine, and the stomach. These three organs are quite distinct organs. They're almost like three different planets. Here's the liver, of course, which is an important sorting house and sorting system. So stomach, colon, and small intestine. For our purposes on deflammation, we're actually quite interested in the small intestine, and that is 4 to 5 meters long, and here it is in tube format, 4 to 5 meters of this. And breaking it down further, we can see that it's got little folds and little finger-like projections, which then help absorb all of the food, etc. And that's where your food is absorbed in your small intestine. So this slide brings us further down into the microscopic part of the small intestine. We see what are called the finger-like villi here, projecting up. And food at this stage would be like a soupish liquid floating around in this sea of frond-like villi, finger-like projections. And these projections have blood vessels in them, but also what we're interested in is this mustardy coloured area around here, which is full of packed with white cells, white cell tissue. And this is the area where up to 30 to 40% of your immune system resides. So all food particles that get absorbed, they actually have to pass through the immune system to get into the bloodstream to get whisked off to the liver. So it's important to understand that process. Here's another slide showing us the again the villi and the cells of the small intestine, where we have what we say the tight junctions are intact. Absorption with tight junctions intact, and I want you to try and understand this idea. So tight junctions, when the tight junctions are intact between the cells, obviously the food item, the food molecule, can only go through one way through. And as you see, it goes through one way. It's attached by an enzyme within the cell, and it changes its form. It changes its structure into a round ball that drops into the immune system area here, which then furthermore goes into the bloodstream and goes off to the liver. So you can see that the shape of the food molecule gets changed by passing through the cell. And in that way, you could say it's got its immune passport stamped, and it doesn't cause a reaction here in the immune area. So here we see the tight junctions have now broken down. And so the food molecule that you saw earlier in the other slide, turning into a round ball within the cell, now drips between the cells. So it doesn't get its immune passport stamped in the same way as when the tight junctions are intact. So then when it drops into the immune area, the white cell area, sorry, it can cause a reaction. And that's the reaction of inflammation within the cell. And that's where the trouble starts to come from. So on this slide we can see the spectrum as such, with tight junctions intact, food molecules dripping between when the tight junctions break down, and then the inflammation that affects the lining of the small intestine. So let's look at this little food molecule here. Let's call it a bit of a gluten protein. It slips through the tight junctions between the cells, and it appears in front of all of this immune system here, which are white cell HLA cells, and triggers off an immune reaction which causes a release of all these little chemicals here, which are called cytokines and or chemokines. And these have a vast range of effects on white cells and other immune elements in the system. Of course, these cytokines also, being in the lining of the small intestine, get absorbed into the bloodstream and drift around the body and cause further trouble. So as you can see from the previous slides demonstrating the leaky gut, that's the problem. So the question is what can cause a leaky gut? So a wide range of issues can do it. Infantile gastroenteritis, starting on the oral contraceptive pill, traveler's diarrhea, Epstein-Barr virus infection, after courses of antibiotics, after courses of surgery, changing countries, parasitic infestations. So there are many routine things that can cause a leaky gut, and my suspicion is most of us have an element of leaky gut as we get into our adult years. And that means that there's an element of low-level inflammation there at a constant rate. And that low-level inflammation, as I said earlier, can drip into your bloodstream and go around the body and cause all sorts of problems, be it thyroid, brain, etc. So what is a cytokine? Well, a cytokine is they're a diverse group of molecules that are used extensively in cellular communication within the body. For example, a well-known cytokine is histamine. So when we get an allergic reaction in our nasal passages from the hay fever or the allergic rhinitis, histamine is released. It's a chemical that can cause a lot of local inflammation and irritation. That can also be released in the lining of the small intestine. And I often compare this inflammation of the small intestine to what goes on in hay fever and allergic rhinitis. So these cytokines can again be absorbed into your bloodstream and reach all parts of the body, brain, muscle, skin, joints, adrenals, thyroid and heart, and cause problems. We know there's a clear link between bloating, inflammatory gut bloating, and thyroiditis, for example. I like to say that deflammation is a numbers game, and that all fasting interventions, if they go on for a period of time, such as 7 days, tend to have one thing in common, be it the grapefruit diet or the vegetable juice diet or the Mayo Clinic, the Bushnell, the Lancet, whatever. If you do it for 7 days, your small intestinal immune system is in contact with less numbers of food molecules over that period of fasting. So there's less chance of reaction, therefore less cytokine release, causing less flow into the bloodstream, causing less inflammation in your body. So over the period of that week, the immune system literally gets a rest. So whichever 7-day intervention you do, my feeling, you'll always get some of the same results. For example, back in the 17th century, there was that famous German beer fast. And it was 3 pints of beer a day with water for 40 days as part of a religious fast in Lent. And that was an interesting fast as well, which again would drive weight loss, would drive similar feelings of well-being. The Holy for the Beer fast for Lent. And this was done by an American journalist in 2014, I think, and he actually did it and logged and blogged about it. And again, the same thing happened. Lost a lot of weight, felt spectacularly better. So it's about, again, just illustrating that deflammation of the intestine is about the numbers game. I think 40 days is a bit too long. I certainly wouldn't be advocating a beer fast. This you need to discuss with your own doctors if you were to embark on the same. But again, it just shows you how the system works in a way. Senolysis. Senescent cells unfortunately accumulate as we get older, and generally from the age of 40 to 45 years onwards, we're definitely producing plenty of them. Difficult to say the actual numbers, but for sure they're there. So fasting has an effect on senescent cells, and I'll explain that to you later. So senescent cells are a bit like you'll have a normal cell, and then for reasons we don't fully understand, cells become senescent. It's like the lights are on, but there's nobody at home. So the cell is using up all the resources, it's alive, but it's not providing the function it should be providing. And senescent cells can happen throughout any tissue, be it thyroid, heart, brain, gut, muscle, whatever, as you get older. And these senescent cells, they secrete inflammatory molecules in the area, for example here. So here's a normal cell and this is a senescent cell. And so these molecules are inflammatory and they irritate the other molecules in the area, or the cells in the area. So senescent cells are they're a bit cranky, you might say. So the good thing about fasting is that it's senolytic. In other words, it breaks down senescent cells. And how might that happen, or why might that happen? Well, senescent cells accumulate in the body, and fasting being a metabolic stress and related to energy needs, the body cleverly gets the senescent cells to commit harikari and they get recycled. So there's recently been a lot of work done on pulmonary idiopathic fibrosis, which is a difficult disease to treat, with quercetin and dasatinib. And quercetin is a well-known senolytic. Senolytic being lysis of senescent cells. Lysis meaning killing off the senescent cells. So things that are senolytic are generally good. Fasting is senolytic. Quercetin and other herbals are senolytic. And senolytics have become a very hot area for investment and research, and I suspect we'll be hearing a lot about them in the next 10, 15, 20 years from the pharmaceutical world. Can fasting prune your inner tree? Well, again, as I was saying, so let's say in the body, the total number of cells on average 30 trillion would be just a number we would look at. There's a bunch of dysplastic cells, and here we have 200 to 400 billion senescent cells. So again, when you go through a fasting 7-day FMD, the senescent cells get literally told to commit harikari, so that their bits and pieces can be recycled and reused. So I liken this to actually as I say, pruning your inner tree. So it's a bit like trimming off the dead leaves from your garden shrubs. So how often should you prune? Well, my feeling is that, as I said earlier on, from the age of 40 to 45, that's when things are starting to go. And I think that's the time that we should really be looking at investing in our long-term health plan. And that's when we should start getting proactive about things like fasting, senolytics, etc., exercise, whatever the interventions may be. But there are definitely a lot of things we can do from 45 years of age onwards to get a return on our wellness and health in our 70s and 80s. And the science again is starting to prove and show this. Autophagy and mitophagy. Autophagy and mitophagy. Autophagy is the process whereby a cell literally eats its own contents, and it's really about recycling. And it's really about sort of cleaning out the dusty cobwebs within the cells. And this is a process that, again, is ongoing. It's in all cells at all times. But when you go again for your FMD, your stress fast, the autophagy, the vacuum cleaning of the mitochondria and the cells increases. So after a period of fasting, autophagy and mitophagy is activated. And as I said, these are the recycling processes at a cellular level. Proteins and damaged and dysfunctional cells are broken down, and the individual parts are actually recycled, thereby conserving energy. But at the same time, getting rid of what we call dysplastic cells, and we feel that these may be some of the precancerous cells. There is evidence to say that increasing autophagy provides neurodegenerative protection, perhaps in our dementias, etc. But again, this is all early science, and we're not really clear on this. So autophagy is, as I said, is a new kid on the block. It's been around for about 15 years as a concept, and so it's obviously more studies are needed, but definitely there'll be more information coming from that world. Stem cell research. So this was a pilot study that we carried out in 2018 on the Kumru cleanse. We took 5 samples of serum 1 week before the fast, 1 week after the program, and 10 weeks later. So that was 3 samples per person, and these were sent off to Professor Steve Ray in Oxford. Normally stem cells, mesenchymal stem cells, double within 24 hours. And in our pulse fasting, the doubling time reduced to 20 hours, which Professor Ray said was highly significant, and the effect was still present in the 10-week samples. Steve Ray was very impressed and was pleasantly surprised by the outcome. So we've decided that we're going to try and do some more research on stem cell activity post-fasting, and he has designed an interesting study seem to try and prove that stem cells become significantly better at killing senescent cells for up to 10 weeks and longer after such a fast as we do on the Kumru cleanse. So hopefully we might have some interesting research results in the coming years. So here's a list of symptoms that can improve after FMD, and in the brackets you'll see these numbers: IL-10, IL-6, IL-1 alpha, and these are what we call cytokines, and these are some of the cytokines that are associated with these symptoms. High doses of IL-6 can cause fatigue, brain fog, IL-6, skin rashes, IL-1 and 2 and 3. One of the things that often improves after such a 7-day clean out is bloating, and bloating to me is a sign of an inflamed small intestine. And so as you clean out the intestine, the bloating settles and a lot of the symptoms can settle with it. So it's a very interesting and simple intervention. So here we have one of my favorite slides put together by Professor Ron Taylor from Nottingham. And he looked at, he's a diabetic specialist, very interested in fasting options for treatment of type 2 diabetes, and has done a lot of fabulous research on this. But I think this slide is really a good slide. This is an image of a 58-year-old patient who was on 7 medications, and he went on a 600 calorie a day diet for 8 weeks. Obviously he had, I think it was 106 kg, he was hypertensive, hypercholesterol, type 2 diabetes, gout, on 7 or 8 medications, etc., etc. But look what happens when you go. The cross-sectional MRI of the body showing the liver. Okay, so at baseline, at the beginning of his fast, 600 calories a day, look at his liver is coloured almost greenish, and that tells us how much fat was around his liver. Well, after 4 weeks, that liver fat is down to 11%. After 8 weeks, it's down to 3%. So miraculously, all the fat from the liver disappears. If the fat from the liver disappears, then the fat around the pancreas is disappearing as well. And this patient, after 8 weeks, his type 2 diabetes was gone. I think this is a very inspiring slide. I often give it to my patients who are keen to lose weight, etc., etc., to say, look, why don't you plasticate this and put it on your fridge door as a reminder of what you're trying to achieve. It's not always just about losing weight and weight and weight. It's really about losing fat around your liver and pancreas, and that's one of the things that that fasting can help you do. But as I say, fabulous slide, and thank you again for this. So just to summarize the benefits of fasting, mimicking diet, FMD. So it's absolutely safe for healthy persons. Of course, one would avoid it if there was any history of an eating disorder. It's always easier to do with someone else or in a group. Find a fasting buddy or a fasting gang or a fasting group. Certainly if you're over 40, I would advise to do it every 6 months as a maintenance intervention to slow down the inflammaging process. And this is the word we use nowadays, inflammaging. And possibly prevent, and this could possibly prevent or delay the onset of cancers, type 2 diabetes, and dementia. But of course, always consult with your healthcare provider before making any significant dietary changes. So also, FMD has been used and studied in chemotherapy as a way of trying to improve the chemotherapy output. And several clinical trials, re-FMD is a tool in progress in the US and in Europe. And so we're waiting for what's called the breakfast trial, and is looking at FMD plus or minus metformin in triple negative breast cancer. And this trial is going to report in 2024. And again, you can see the logic of that. If you do a 7-day or even a 5-day 800 calorie fast or 600 calorie fast, we can see that you turn down inflammatory noise in your body. And it looks like that in conjunction with some other options such as metformin and chemotherapy can have an overall therapeutic effect, a beneficial effect. It makes scientific sense to me, but again, we're waiting for the trials to report. And as I say, the breakfast trial is one to watch, and hopefully we'll get good news in 2024 on that. So again, at risk of repeating myself, fasting takeaways, the takeaway fast. So fast responsibly, and actually take responsibility for your own health if you can, especially if you're over 40. Always discuss with your healthcare provider before making any changes to your diet. As I said earlier, it's not advisable if there's a history of an eating disorder. And always think long-term. We should be starting to think long-term planning for our health outcomes, 10, 20, 30, 40 years down the road. And it's something that's missed, I feel, within our current medical system. We should be looking at, as I say, what I call the HIP, the health investment plan. What am I doing now for my health down the road? So consider things like exercise. Pilates, I think, is an excellent one. Yoga works with lots of people, meditation, but it's about finding your own individual roadmap and your own way to improve your health span, lifespan. In my own personal experience, I tend to use Pilates, FMD, and cycling, and that seems to work for me. And as I've been doing that now for the last 8 years, and fingers crossed, touch wood, it seems to be paying dividends. So I'm just here really trying to share this and encourage you perhaps to look at this way of investing in your own health. And of course, post-COVID, this is all becoming increasingly clear that we should be taking more responsibility for our own health, because our medical systems are fragile at best. And for further reading and information on the topic, 2 excellent reviews in the Annals of Medicine and the New England Journal, and you can just take this slide from this talk and do your own research on that. And here are the references, and so stay good, and hopefully this was helpful and helps you to think about your own health, which is the object of the exercise. Put the science out there and get you inspired to do a bit of fasting yourself. As I always say, any fasting is better than no fasting at all, as long as you don't have an eating issue. So thanks for listening, and stay good and stay well.